Hi, I'm Steve Nichols from Adelaide, Australia, and welcome to A Career in Cardiology. I'm here at the 2014 Scientific Sessions of the American Heart Association in Chicago, Illinois, and it's a pleasure to be here with Spenser King from Emory, and it's a great opportunity for the next few minutes really just to kind of reflect, Spenser, on your career and talk a little bit about your journey through cardiology, interventional cardiology, and perhaps a bit of a sense for where this is all kind of going. Thanks for joining us.
Thanks, Steve. Yeah, it has been a long time, but we don't need to concentrate on how long it's been. I got interested in cardiology, I think, before I was interested in being a doctor. In med school, I had a professor of physiology named William F. Hamilton. And he was the guy that first measured blood pressure, and he wrote a book of physiology text. And I was fascinated by the mechanics, and I was a lousy student in biochemistry. So I said, the heart makes a lot of sense. I think I really decided to be a doctor along about my second year in medical school. So, but I've always had a fascination with cardiology and how things work, and also later because it's such an important part of what we do. I was, I don't know that my career is terribly thrilling in terms of how I did it. I had a military experience. I was at Walter Reed Hospital, then off to your part of the world, to Vietnam. Was not cardiology. That was an experience. Came back to Emory, and I did all my cardiology training at Emory. Willis Hurst and Bruce Logue were my mentors, and I stayed there for all of the training. Then I went away to the University of Colorado. I was there for a couple of years, and they said, look, there may be something to this coronary bypass surgery. My interest was in coronary disease and angiography, and I became quite experienced in that while in Colorado, and I came back to start the cath labs at Emory.
It's a great story, and it's one that many of your peers kind of share, this kind of getting into cardiology at a golden era where there were such amazing advances in our knowledge from a physiology perspective, and then we saw this kind of whole era of therapeutics kind of come, which really changed our ability to treat patients from a cardiovascular perspective. You kind of become a part of the scene in terms of the angiogram becoming commonplace, that enabling revascularization with bypass surgery, and then the opportunity to work with Dr. Grunzig, and really in the kind of seminal moments of the birth of percutaneous coronary intervention. What was that like?
So I've been directing the cath lab at Emory since '72. So in '76, at this meeting, American Heart Association meeting in Miami, he had a poster. I still have it. A poster of his animal experiments leading up to angioplasty of the coronaries. He had never done one at that time. It was interesting. I couldn't imagine it would work. In fact, I said so. I said, this will never work. I told him that. But after a year, he had done the first patient, and then I began to go to Zurich. And in January 1980, riding on a train with him in Switzerland, we were going out in the Emmental Valley to a party after one of the meetings. And he sat down beside me and said, look, I'm not getting enough support that I want to develop angioplasty the way I want to, and I'm going to leave Zurich and I'm going to go somewhere. And I said, where? He said, either Germany or America. And it's a long story, but the place that he was going in America, when I asked him, was Cleveland Clinic. And so the conversation went like this: why are you going there? What do you want to do? He said, well, I want to guide the technique. I want to help shepherd it as it goes along, not let it get away from me. And I want to be professor, with a European concept of what professor meant. And I said, well, that's all very interesting, but you can't be a professor at Cleveland Clinic because at that time there was no medical school. And this kind of stopped him, and he began to say, well, what should I do? And we began to talk, and I said, well, among things, why don't you come visit me at Emory? And he did, and it became an interesting thing with my old friend Mason Soanes pulling on one side of him and me on the other. And finally he did agree, decided to come to Emory through our efforts. I think he would have been perfect at Cleveland Clinic, but he came to Emory. And so we worked together for 5 years, and it was quite a exciting time of training all the early people getting involved in angioplasty.
Yeah, and did you get a real sense at that point in time that it was going to proliferate the way it has?
You know, I've referred to it as a pebble in the pond. I mean, this is almost unbelievable how the waves have moved out from this one seminal development of a balloon in the coronary artery to everything that's happened in interventional cardiology. And I think he would be amazed even today at what's happened.
I mean, it really has just been an extraordinary journey if you think about it, you know, from going from, you know, inflating a balloon in the coronary artery. Now we're, you know, deploying, you know, valves across percutaneously. And I mean, along that way, I mean, which of these things continue to surprise you?
Well, you know, I think the development of the specialty was very important. And after I spent the year as president of the American College of Cardiology, I took on the job of trying to get it officially recognized. So we proposed the subspecialty of interventional cardiology, and I chaired that for the first 10 years. And I think this kind of made interventional cardiology a specialty, so we kind of put some parameters around it. Unfortunately, it was limited at that time because we were not allowed to bring in peripheral vascular into that. That was one of our conditions. Over time, that has moved in. Structural heart disease has moved in. The idea that we would be putting valves in percutaneously, the idea that we would be closing defects, maybe not so far-fetched, but some of the things we're doing addressing not only coronary disease, but valvular disease, heart failure, it's quite exciting, and I think it's gotten so interesting that now we begin to find interventional cardiology beginning to subspecialize a bit. So we have people getting off into various components, and that's good in driving the technology, but you know, we like to view ourselves as interventional cardiologists, whether we're in the periphery, structural heart disease, or still in the coronary arteries.
Right. So maybe just to conclude, you know, you've already said you're president of the ACC. You play a very important role as the editor of JACC Cardiac Interventions. You've mentored a large number of fellows over the years at Emory. What's your advice to the early career guy who's just kind of starting off in this kind of whole world of cardiology and kind of looking to kind of follow a path?
Well, you know, people tend to be a little pessimistic about medicine these days, and I think it's a mistake. I think medicine is the most exciting thing you can possibly do, and I think cardiology is right at the top of that. We're finding that many of our brightest graduates from medical school are drifting off into lifestyle specialties. Some of them say, well, you know, things are not as hot as they were. I don't believe it. I think the excitement of combining the care of patients, the magnitude of the issues that we deal with, this is not a marginal kind of problems we have. Cardiology is central. And the ability to develop technology and work with technology that is not going to stop. Yes, we've achieved a lot of things, but the old adage that everything is going to be invented has been invented, no. I think we're right on the cusp of very exciting things. And the fact that we're hopefully someday have a control of vascular disease and atherosclerosis, maybe through medical means or genetic engineering, doesn't dissuade me from the idea that the heart is a fascinating structure. We do continue to have problems with it. And I think for somebody in the early career who gets into it, and maybe I'm not addressing the question completely, but I think that the idea of is so broad that it can encompass a great many people with very different ideas, all the way from public health, from prevention, from biomechanics, to the genomic alterations. There are so many things exciting in cardiology, and interventional cardiology, in my view, sits right in the center.
Look, I think you've answered it perfectly, and look, I'd like to thank you for spending some time with us today. I'd like to thank you for joining us today on EHJ Today, the Voice of Leaders.